Hello friends, I am Manali Reshamwala, Assistant Professor from LG Institute of Physiotherapy. Today I am going to talk about suspension therapy. In first year physiotherapy from Gujarat University, it is a part of syllabus in exercise therapy subject. You must be thinking, what is suspension therapy? Let's understand it in detail. First of all, let me clear your doubt about what is suspension. Actually, suspension is not something to hang on, or it's not like suspending someone from school or college, but it is a therapy. It is a suspending a part of body or whole body with supported slings and pulleys. So let's see this suspension therapy in detail. For that, first of all, we need to know the instruments used for giving suspension therapy. So these are the suspension instruments, namely suspension frame, supporting rope, wooden cleat, pulleys, slings, S-hook, and dog clips. Let's see each and every one in detail. First, suspension frame. What is suspension frame? It is made up of stainless steel or plastic coated steel. It has measurements given in the slide. Some of the suspension frame come along with a plinth below it, some does not. We have to keep it inside a suspension frame. Next is supporting ropes. Usually the supporting ropes are 1.5 meter in length. They are 3-ply hemp rope so that they have very good strength and can hold a heavy weight or heavy object easily. Its one end is usually fixed with a ring or a hook, and another end is used. On another end, there will be wooden cleat. What is wooden cleat then? It is used to alter the length of the rope. Usually, there are 2 or 3 holes in this wooden cleat, and we have to tie a knot at the and at a hinge manner along with the wooden cleat so that it will not slip off from there, as well as if we keep that wooden cleat in a somewhat inclined plane, it will remain fixed, and because of friction the height of the rope will not change. Then pulley, it gives mechanical advantage. It's a grooved wheel around which we can pass a rope used to reduce burden of lifting whole body or body part. Here are some of the slings. They are usually made up of canvas material. There are 4 varieties of sling. We can see that A is showing a sling, single sling, then double sling, head sling, and 3-ring sling. Let's see these slings in detail. First is single sling. It is 68 centimeter in length and 17 centimeter in width. It has D ring at both the ends, used to support elbow and knee region, sometimes folded in figure of 8 to support wrist and ankle. Double sling, more than 2 slings sides, there will be the rings, and it is used to support thorax, trunk, and thigh. Head sling, we can see a hole in middle of the head sling, and that is to support or to give relief of pressure from occipital area. Whenever we want to suspend head, we should use this head sling. And last is 3-ring sling. uh, there can be also double ring sling. Usually they are lengthier, 75 centimeter length and 3 to 4 centimeter in width. But in width they are thinner. It consists of 3 rings and it is used to support wrist and ankle the way shown in figure. Lastly, there will be S-hook or dog clips to attach supporting rope with the mesh, and also to attach sling with the supporting rope. When there will be a loop between the 2 holes of the wooden cleat, we can use S-hook or dog cleat, and to which we can also attach 3-ring sling or single sling. So that's it. That's all about the instruments. I know there's so many instruments. This is the one of the exercise therapy uh, you know exercise therapy which requires lot many instruments. So let's see principles of it. Usually, suspension therapy works under three principles: friction, pendulum, and eliminating gravity movement. Some of the things you know, let's see it in detail how it has worked as a suspension therapy principle. So, first principle is friction. As we know that friction is a force which restricts movement of an object. So the main factor on which friction depends is the surface, type of surface, I mean. So if smooth surface is there, there will be less friction and more movement can be achieved. And if there is hard surface, more friction and less movement will be achieved. So in how friction is used in suspension therapy, if we reduce friction during suspension therapy, it provides easy and smooth movement. Obviously, when we'll be lifting a body part from the surface, there'll be less friction. Next is pendulum. Pendulum is what? If we attach a metal ball or a weighted ball with a thread to a suspension point, and if we give a force to it, it will be oscillating. One oscillation means when a ball goes for one swing to another swing and comes back is known as oscillation. So these kind of oscillatory movement even occurs in our human body, that is at hip joint and shoulder joint. Usually it occurs while walking. As we know, while walking our hands are usually oscillating, so, or swinging, I would say. So that thing we are using over here in suspension therapy also. And that oscillation thing can be achieved only with simple muscle contraction. Use in suspension therapy will be of pendulum is to maintain muscle property, to increase range of motion, and strengthening the muscles. Next is eliminating gravity movement. Gravity elimination. Effect of gravity on movement can be eliminated for patient with muscle power too. Okay, this is something new for first year students, as if person is doing movement against gravity, or he'll be able to finish that movement in full range of motion against gravity, that is known as muscle power 3. And if they are not being able to do it against gravity, but in gravity eliminated plane, that is in horizontal plane, but with full range of motion, that is known as grade 2. So here in suspension therapy, we can give exercise or variety, plenty of exercises in eliminated gravity position. So this is one of the best use of suspension therapy by which we can increase strength. If person is having only grade 2, we'll be first giving them exercise in grade 2 or gravity eliminated posture, and gradually we'll be going for inclined posture. So this is the best example of increasing strength using suspension therapy. I'm sure you must be much curious to know more about suspension therapy. So let's see about the types of it. First type is axial suspension, second is vertical, and third is pendular suspension. Here's pendular. So first is axial suspension. Point of suspension is usually joint axis. That means whichever the joint we want to treat or we want to give suspension for that joint movement, that joint axis will be the point of suspension. Limb moves both sides parallel to the floor. Okay, so whenever the point of suspension, we can move it on the medial and lateral side of the point of suspension. What are the use of axial suspension? One, it provides relaxation. Second is maintain muscle property. That means we'll not be able to increase strength through axial suspension. We'll just be able to maintain muscle property. As with axial suspension also, muscle have to just slightly contract. Then it helps also to increase blood circulation, to increase venous drainage, and increase lymphatic drainage. Second type is vertical suspension. Here, point of suspension is center of gravity of the part or body being stabilized. For example, here in figure, we can see that arm is stabilized by using vertical suspension, and the point of suspension over here is center of gravity of the arm. So the use of vertical suspension is support the body part. Like for example, we already discussed about arm. The same way we can also support the thigh. Or, or as well as we can also reduce the pressure sore. Um, or we can reduce the pressure or the area where there are more chances of getting pressure sore through vertical suspension. Last type is pendular suspension. First point of suspension is axis of the joint. So in pendular suspension, first of all, we have to find out the joint axis and we have to keep a point of suspension of pendular suspension as well at that place. That means it will be like a axial suspension. Then depending on the strengthening of the muscle group, it changes towards medially or laterally or anteriorly or posteriorly. So that after we arrange axial suspension, we have to move our point of suspension opposite side towards the movement of the which muscle we want to strengthen. Right? So we'll be able to strengthen those kind of muscles. So use of pendular suspension is to strengthen muscles and to increase endurance. Let's see the advantages of suspension therapy. The first and foremost example or advantage is it reduces the burden of therapist. As we know that our clinics, where there will be so many patients at a time, and as a therapist will not be able to give time or to give support to each and every patient for whatever the reason. So for that, if we give suspension therapy, it reduces burden of therapist, and for some of the time, patient can do their his or her exercises alone. Second thing, it makes us easy to lift the limb. It makes us, especially lower limb, if it is very heavier, we can using suspension therapy, we can reduce our burden of lifting it. And last is active movement can be performed easily with minimum friction. Disadvantages. Yes, it also have some disadvantages as patient may do trick movements. If patient's muscle strength is not proper and the treatment plan we have decided is also not proper, the patient may do trick movement. For that, we require some of the stabilization which will avoid trick movement, as well as some of the observation, which is one of them. Another disadvantage of suspension therapy is patient is not continuously under the observation of therapist and may lead to more of the trick movement and more of the pain. So these are the advantages, but I'm sure we can um, rule out a situation with reducing the disadvantages. I have taken this suspension therapy notes from textbook of therapeutic exercise and uh, practical exercise therapy book for further reference. Thank you. I'll be talking in next topic about breathing exercise. Thank you.